Hey, how are you all doing today? All right, my name is Dr. Fred Echols. I am the acting director of the health department for the city of St. Louis, so I oversee all of the health initiatives for the city of St. Louis. And so we're here today because I want to hear what you all think about the COVID-19 pandemic. Do you know anything about the pandemic? All right, so I want you to ask the questions. I want to hear what you all think about the pandemic, and then I'll give you questions and let you know what my thoughts are. How does that sound? Perfect. Are you ready? All right, you had the mic already, so we'll start with you.
Okay, so why do we gotta wear masks?
That's a great question. So what we found out early on is, so there's a virus that causes what we call COVID-19. The virus spreads when people talk and people sing. And so every time you talk and sing, open your mouth, you release these droplets, what we call aerosolized droplets. The droplets are so small, sometimes you can't see them, sometimes you can see them, but most of the time they're so small that you can't see them. But if they're infected with the virus, that virus can be inhaled, or some other people can breathe that in, and then that can cause illness for other people. So by wearing a face mask, you prevent people from being exposed to your infected droplets, but it also protects you because it prevents you from being exposed to theirs, if that makes any sense. You got it? So now I'm gonna ask you to explain why you wear a mask.
We wear a mask because it's these little things that's called airdroppers, and they small. You can't. Sometimes you can see them, but you can't. So that's why we gotta wear a mask.
Okay, and sometimes they can have viruses and other things included in them, so that can make people sick. So this helps you protect yourself, but also helps protect people that you care about. Great job. Who's next?
Why do we have to go to wear a mask into the store every time?
So that goes back to Gregory's question, right? So why do we have to wear a mask? So when you go into a grocery store, do you just hang out with people that's in your household, or people that you live with? Or do you see people from all across the city of St. Louis?
I don't see nothing about it though.
And so if you go to, let's say you go to Walmart. When you go to Walmart, are you in there by yourself?
No.
How many people are typically in Walmart?
Like 50 to 100.
50 to 100. That's a small Walmart. What Walmart do you go to?
A big one.
Okay. So when you go to Walmart, you have a bunch of people that are in there, right?
Yeah.
And so when you go into these places where there are people who you don't live with, sometimes they can carry infections with them. So sometimes they can be infected with the flu, they can be infected with the COVID-19, the virus that causes COVID-19, and a lot of other things. And so when you go into those places, it's important to wear a face mask because you don't know if those people are shedding virus, if they're infected with other things. So this helps protect you when you're in a crowd of people who don't live in your household. Does that make sense?
Mm-hmm.
So I'm gonna ask you to explain to me why you wear a face mask when you go to places in the community.
To protect yourself and other people's to not get COVID or your germs.
That's good. Go ahead. You expanded on that. You said COVID and germs. Go ahead. All right.
Why do you have to social distance?
Oh, that's a great question. So one of the things that we found out early on is that, you remember we was talking to Gregory about the air droplets, right? That when you talk and you sing, you release these air droplets into the environment, right? So they can travel a certain distance. What we found is that 6 feet is about the average length that they will travel. And so by placing people 6 feet apart or social distancing people, that reduces people, the likelihood that people will come into contact with those infected droplets.
I get it.
Okay, so now I'm gonna ask you to answer it. So why do you need the social distance?
Because so that way other people's germs won't get on you, and if you touch the other person, you don't know if they have germs or not, or maybe COVID-19. So if you touch them, maybe you can get sick.
That's right. So touching them, but also like breathing in their
Air?
Breathing in the air, yeah. Because if I don't have this face mask on and I exhale and my infected droplets go all over the building, you can inhale that, right? But if you're too far away to inhale it, then that protects you.
Yeah.
Great job. You're up.
Why do we have to get quarantined in our houses?
That's a great question. So quarantine is important because sometimes people can be exposed to different illnesses. And so by quarantining, what that means is that people have to remove themselves from other people. Can I give you an example of what that could look like?
Yes.
So you see these 4 people right here, right? So let's say we're going to pick on Gregory. So let's say Gregory was exposed to someone who had COVID-19, but he doesn't have any symptoms. What we need to do with Gregory is to prevent Gregory from potentially exposing the other people. We need to have Gregory isolate or quarantine. So we'll have Gregory, you can walk towards me. We'll put you over here. So just hang out right there. So now because Gregory is separated from the other people, the likelihood that he would expose them to an illness if he develops symptoms is low. So that's why quarantine is important. So you separate people from the general population or from others to prevent them from potentially getting exposed to an illness. So I'm gonna have you explain that back to me. So why would Gregory need to quarantine?
Because he has been around a lot of people, and he doesn't know if those people have germs or not. And to protect himself, he needs to stay in the house.
He needs to stay in the house, absolutely. So we only have people quarantined if they come into contact with someone who tests positive for an illness. So he would only need to separate himself if someone that he was in contact with tested positive for COVID-19, the flu, or anything like that. All right?
Okay.
That's a great question. Who's next?
So my question was, if you're vaccinated, why do you still have to wear a mask?
That's a very important question. So one of the most recent situations that occurred in Massachusetts showed that individuals, even if they were fully vaccinated, they could transmit or spread the virus to other people. And so it's really important for us to be mindful of all segments of our population, not just those who are vaccinated, but those who are not yet vaccinated. For example, children younger than the age of 12 are not eligible to receive a COVID-19 vaccine. So there are other people who may have what we call contraindications that prevent them from being eligible to receive a COVID-19 vaccine as well. And so it's important for us to be mindful of the entire population, of everyone in our jurisdiction. By wearing a face covering for individuals who are vaccinated and unvaccinated, it helps provide that extra layer of protection, and it helps us better slow the spread of the virus in our community.
Okay.
And I have a question for you before you leave. So in the city of St. Louis and in other parts of the country, minority populations have been disproportionately affected by the spread of the virus. So for example, right now in the city of St. Louis, roughly about 80% of all of the new COVID-19 cases are people of African-American origin. So how does that make you feel? And if there was one message that you wanted to share with individuals in our community, what would that be?
Well, I know for certain most low-income people ride the bus a lot, and which would spread the germs and stuff like that. So if you know you take public transportation and you're old enough to get the vaccine, I would just say just get it, because I mean, it's just like a regular shot. It don't cause no pain. So get it and keep going with your life.
So I take it that you received the vaccine.
Yeah, I did.
Why did you receive the vaccine?
I'm going to college, and it was a requirement, but also my mom had got sick and got COVID, and I didn't want it, so I got the vaccine.
So how did it make you feel when seeing your mother go through that experience?
It was terrible. She was like throwing up and stuff, and like had to stay in her room, and it was just like isolated, and it was just weird. And she had it for like more than 2 weeks because she was also pregnant. It was just a lot, and I didn't want to go through that.
And so oftentimes we have to see how other people experience a particular issue and sometimes that can lead us to make certain decisions. But unfortunately, sometimes people make that decision too late. So when we look at the information in the city, we also know that 60% of all COVID-19 associated deaths are of people of African American origin. So it's really important for people to really hear your message. I mean, seeing how your mother went through it and being able to advocate for yourself, even though it was a school requirement, you were able to make the decision for yourself to get vaccinated. So we applaud you for that.
Thanks. Great.
So we'll have your colleague come.
Hi, my name is Noel. Why do you think people are hesitant to follow the rules of trying to lessen the spread of the COVID virus?
So that's a really complex question. So when we look at behavior, oftentimes behavior change is the most difficult thing to address in public health and just in society. And so I know there's a lot of individuals who feel like it could be an infringement on their personal rights. But as a public health agency, what we're responsible for is making sure that we operate in the best interest of the entire population. And so by having these mitigation measures in place, such as wearing a face covering, social distancing, and other recommendations, it's really the goal is to prevent the spread of disease so that we can protect the health of the population. When you hear the term personal liberty and as how it's been used during the pandemic, how do you feel about that?
Well, honestly, I feel like people have too much, people have their own thing too much. Like, they want to do something, like be a rebel of some sort, And I don't think that's a good idea, especially right now. You have to think for other people. Even if you're vaccinated, I think that you should still wear a mask because there's still a possibility that you're asymptomatic and that you can still spread the virus if you're not wearing a mask. So, yeah, I guess people should still follow the rules.
And I think one of the messages that we're trying to convey is, that wearing a face covering, getting vaccinated, social distancing, all of these things are what we consider acts of compassion. So not just consider being selfish and thinking about our own well-being, but thinking about how our actions can impact the livelihood and the health of other people. And so by simply wearing a face covering, that's a way of showing that you care about the people around you. And so we really want to echo that message. And one thing that has been a challenge as well is making sure there's consistent messaging from the federal government, state government, and local government. Because early on there was a lot of mixed messages that were coming out, and I think that led to some of the rebellion that we saw as well, not only in the St. Louis area, but also across the nation.
Okay.
If there was one message that you would want the St. Louis community to know, what would that be?
Be responsible. That's it. Just be responsible towards your actions and don't be selfish. Yeah.
Great. Thank you. How are you doing?
I'm doing great. How are you?
Pretty good. So what question do you have about COVID-19?
One question I have is, what is your opinion on the potential mask mandates and vaccine requirements? Like, how do you feel about if a job requires you to have a vaccine and wear a mask, and you don't want to, then you will possibly be fired or non-eligible for a job, or for home. This applies to home, schools, etc.
So two questions there. So the first question, how do I feel about the mask mandate? So I support mask mandates because what we've seen is that not everyone is responsible, not everyone is honest. And so by having a mask mandate and requiring individuals, whether they're vaccinated or unvaccinated, to wear a face covering, especially if they're indoors, is really important. And again, that measure is important because over 90% of COVID-19 transmission occurs in indoor spaces because there's poor ventilation and people tend to gather in close proximity. And so that has led to that particular finding that we discovered. So over 90% of cases are transmitted in indoor spaces. For requiring vaccinations in particular agencies, I think that's an agency-specific issue, so it depends on the types of services that are being provided. For example, a lot of the hospital systems are adopting policies that mandate COVID-19 vaccine. And I think because of the type of services that they provide and the type of individuals that come into their facility, I think that's really important for them to protect the population that they're serving, as well as their staff. For example, early on during the pandemic, hospitals were hit really hard. A lot of people who were developing severe complications because of COVID-19 were being hospitalized. And so by having staff who were vaccinated, you ensure that they have the proper protection, at least additional protection, so that if they do get ill, they do get infected with the virus that causes COVID-19, the likelihood that they'll have severe complications or even die from the infection is significantly reduced. And so I think we have to do a better job of messaging about the vaccine, because it's not a silver bullet. It doesn't prevent transmission, but it does preserve life. It preserves individuals' lives by reducing the likelihood that they'll develop severe complications requiring hospitalization or even death if they get infected. And what are your thoughts on the impact that COVID-19 has had on African-American communities?
I feel like the African American community has been hit especially hard in this pandemic, especially with the lack of resources that we already have our issue with. In terms of schooling virtually, we had to kind of scramble to get laptops and hotspots for students, and some families just couldn't do it. Some families had to adjust, and some of it was easy, some of it was hard. And for like you said, medical workers, they were hit especially hard too. And in terms of the employment rates, I feel like African Americans were hit once again especially hard in terms of the unemployment rate over white Americans, because prejudice, I guess. Like we were naturally disadvantaged from the start, and the pandemic just kind of made that abundantly clear.
If you can say that one more time, that is really an important point that people need to hear.
I feel like African Americans, since we were disadvantaged from the start, the pandemic just made it abundantly clear on how disadvantaged we were.
So that's something that I think some individuals have overlooked. But when we look at how the disparate outcomes that have occurred over the course of the pandemic, and even what we're seeing right now with African Americans accounting for 60% of COVID-19 related deaths and 80% of the newly reported COVID-19 cases, that's really important, because when we think about heart disease, diabetes, chronic lung disease, which populations were disproportionately affected before the pandemic? African Americans. And so add COVID-19 on top of that, we already know that they have a higher risk of severe complications and death, and that's exactly what we saw. So COVID-19 swept through our community, and more African Americans were dying than any other population. So if there's one message that you would want to share with the City of St. Louis community, what would that be?
It would be to, well, for one, in general, stay safe, and two, this will be a valuable lesson as for the African American community, and how we could help each other, and how we could further build upon this and other issues in general, such as police brutality and unemployment and homelessness and things of the sort. So I would say to don't see it as a problem, see it as an opportunity to better ourselves as a community and as a race in general, and show other races and countries that we are like not who they say we are, but we are actually better.
We're better. Say that again, we're better.
This is not a problem. It's an opportunity to show other races and countries that us African Americans are not poor. We're not just sitting here. Not just sitting in sorrow about the pandemic and how it's hurting us. We should be using this as an opportunity to show them that we can work through this and that we can be a community in this situation.
Then one more question for you. So the health department is really at the forefront of a lot of this work. What advice would you have to, what advice would you give to the City of St. Louis Department of Health as we move forward to engage communities, to bring them together, to not only to connect them to vaccine resources and education materials, but to improve the trajectory of health for minorities in the city?
I would advise them to bring in more clinics in the African American community. For example, I want to say birth control clinics, OBGYN, stuff like that. In general, general medical clinics. We should implement more health classes in more schools and update that information on health, because information is updating every day and there's so much that we know but also still don't know, and children should know these things before it gets too late and they get blamed for doing these things even though they don't know these things in general.
No, that's really great. Thank you so much for your time and your information. We appreciate you sharing with us.